How to understand complex colon cancer CORT scan terms. Understanding the terms used in CORT scans for colon cancer can feel overwhelming. However, breaking down the terminology can make it much easier. Let's explore some key concepts related to CORT scans, diagnosis, and staging of colon cancer. A CORT scan, or computed tomography scan, is a powerful imaging tool that combines X-rays and computer technology. It creates detailed cross-sectional images of the colon and surrounding tissues. This imaging helps doctors detect tumors, determine their size and location, and assess if cancer has spread to other areas, a process known as staging. Sometimes, a contrast dye is used to enhance the images, making it easier to see organs and any abnormalities. You may come across terms like colonography or CORT colonography, which is a specialized type of CORT scan. In this procedure, air or gas is introduced into the colon to inflate it, allowing clearer images of the colon lining. This technique helps in detecting polyps or tumors. Another important term is contrast dye, which is injected into a vein to improve the clarity of the images by making blood vessels and tissues more visible. When reviewing a CORT scan report, you might see phrases like circumferential thickening. This means the colon wall appears thicker all around, which could indicate a tumor or inflammation. Bowel obstruction is another term you may encounter. It refers to a blockage in the colon, often caused by a tumor. On a CORT scan, this may appear as dilated bowel loops before the obstruction and a narrowed area where the blockage occurs. The transition point is where normal bowel changes to obstructed bowel, crucial for identifying the tumor causing the obstruction. Multiplanar reconstruction is a technique used in CORT imaging that creates images from different angles. This helps visualize complex anatomy and any abnormalities more effectively. As you read through your CORT scan report, pay attention to the tumor location. Reports usually specify whether the tumor is in the right colon or left colon. Tumors on the left side are more likely to cause obstruction due to the narrower diameter of the colon. The report may also describe the size of the tumor and whether it has invaded nearby tissues or organs. Lymph nodes are another important focus. Enlarged lymph nodes near the colon may indicate that cancer has spread. The report often notes their size and number. Additionally, the CORT scan checks for metastasis, which is the spread of cancer to other organs like the liver or lungs. You may also see terms like ileocecal valve, which is the valve between the small intestine and colon. Tumors near this area can lead to small bowel obstruction. Other terms include abscess or perforation, which refer to complications where infection or holes in the colon will occur. Cachexia is a term that describes weight loss and muscle wasting related to chronic illness like cancer, and while not a CORT term, it may be relevant in discussions about overall health. For patients preparing for a CORT scan, it's essential to follow any instructions given by your healthcare provider. This may include bowel cleansing and fasting to improve image quality. If you have allergies to contrast dye or any kidney issues, be sure to discuss these with your doctor beforehand. Always remember to ask your healthcare provider to explain your specific CORT report findings in terms you can understand. CORT scans are just one part of the diagnosis and staging process. Other tests, like biopsies, are often needed for a complete assessment. By understanding these terms and concepts, you can have more informed discussions with your healthcare team about your diagnosis, treatment options, and prognosis.